Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Not a doctor but a nurse. Had a patient come in with a toothpick in his penis. Refused to tell me how it got in there. Insisting he was picking his teeth and it fell in. Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. I admitted a guy for chest pain. As part of the workup, I did the urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news. You didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer: "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face. Which is why my urine was positive. MMMHMM. Got it?" Obligatory not a doctor. I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. I'm a pediatric dentist. So maybe not the type of doc you were looking for. But this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before. So I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank. Even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites. But one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah. I'm 100% not sedating your child today. Obligatory not a doctor. Used to work PR and marketing in an inner city hospital. Was once hanging out with the ER folks when a regular came in. He was into self-harm. This would have been in 2001 or so and I was young. So I had never even heard of this. This guy had spent hours burying a Phillips head screwdriver in his abdomen, carefully working it around major organs. He was a Vietnam medic and had some training, so he could feasibly do it. He straight up said, "What screwdriver? You all are crazy." The attending was staring right at the x-ray and the handle of the screwdriver sticking out of his abdomen. The screwdriver must have been 4 inches long. I still shudder. I once had a patient come in with large calluses on the front of his ankles, which is a very unusual place to get calluses. Brought it up a few times because I thought maybe he was wearing his shoe wear improperly. But he kept waving off the question. Eventually I got him to admit that the calluses are there because he recently started taking a prescription antidepressant medication which made it very difficult for him to achieve orgasm. He found that if he lay on his living room carpet with his legs bent out beneath him in a W fashion and jerked off for several hours he was able to achieve orgasm. Nurse here. Had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote: she never got out of her bed. Had a patient in hospital. I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM. Massive pupils. Couldn't sit still. We asked him what he'd taken while he was out. Nothing. He swears. He went to the pub and just drank lemonade. Okay. We say, "We're gonna take some blood and find out what you've taken." He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Blood confirmed that he had taken speed. But he insists he didn't take it. His drink was spiked. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy. You okay in there? Sink on full blast. Yep. Everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy. Are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie. You gotta do better than that. This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. When was their last meal? They think they can fool their PET scan. End up losing money, time and over irradiated. I feel your frustration to my soul. Sir, have you eaten this morning? Nope. Not since before midnight. Meanwhile I'm looking at a sliver of contracted gallbladder. Are you sure? Because I would hate for this test to come back incorrect and you end up meeting with a surgeon when you don't need to. I might have had a couple of waffles and eggs. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where. After some prodding and letting him know the seriousness of his situation, he finally admitted to the source of his infection. He didn't want to say it, so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus-draining scrotum. Some of it was even black and necrotic. Not a pleasant sight and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection and given antibiotics. The problem didn't go away and by then he had decided to take matters into his own hands. Literally. He tied a string tight around one testicle and proceeded to cut it out himself. Needless to say, it became horribly infected and was going to require surgical intervention. Guy ended up doing okay. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, I think this is all a joke and you put it up there. Yeah. She was totally trying to cheat a drug test. Other than all the random things that end up in rectums accidentally. Drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug tox screens we do that come back positive for something and everyone is shocked. Borderline offended it got into their system. You weren't breathing. We gave you Narcan. You started breathing again. Woke up. And then deny you used a narcotic. Yeah. Alright. Had a patient refuse to admit he swallowed a pen. Even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. Removed. I volunteer at an ER. Prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Ike insisted he had no idea how it got there. We spent hours deliberating how to get it out. And he just reaches down, still in his handcuffs, and pulls it out himself. Edit. You can't get stabbed if you're not in the prison. And any sort of self-harm will land you on suicide watch, which is brutal as well. Weird SX stuff though. No problem. Prison nurse here. We see this frequently. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citra seeds pits. So many of them. When asked why she put them there, she said, "Oh, so well, I eat a lot of fruit and wouldn't accept any responsibility for them being there." All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married. To be fair, the patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. I'm a nurse, not a doctor. But it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart, or any other surgery. Eater. A lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this. If you're going to land in the hospital for a significant amount of time and you're an alcoholic, it is to your benefit and safety to be honest about that. Because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last. Sounds like a lot of you have run into TTY. Judgy people in healthcare. We aren't all like that. And even the judgy ones really don't want you to detox on their shift. I can literally smell the smoke on your clothes and breath. See the nicotine stains on your fingers. And you're trying to tell me you quit smoking 10 years ago? Had a patient on our service for a heart failure exacerbation. We weren't sure why she had one now as she had been stable for a few years prior. She also had a documented past use of crack cocaine. So we checked a urine drug screen. The screen was positive and the next day I rounded on her. She asked me why she had the exacerbation. I told her it was likely due to her cocaine use. She was shocked that I would accuse her of using. I brought up her positive drug test and she insisted it was a false positive and told me she must have picked up the false positive from a toilet seat. That's not how any of this works. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in ER. No maternity ward in their hospital and she was in advanced labor when she arrived, and she still insists she's a virgin. Edit. Poor wording. My husband was the doctor, not the 17-year-old girl. My patient presented over several months with recurrent huge abscesses that we couldn't explain. She was in horrible pain. Had to stop working. We tested for everything. Eventually her husband called me that he found syringes in her medicine cabinet. We think she was injecting herself with fecal matter. When the syringes were found she stopped coming to her appointments. To those asking why, I think she has Munchausen syndrome. She wanted the attention from being sick. I started getting suspicious when she always would get a new abscess before any court dates, CPS problems, and need a doctor's note to get out of it. She denies everything and it's very hard to have someone committed unless they are acutely suicidal. Not a DR. But worked in a hospital for a long time. Had a PT come in that had OD on heroin. Was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew but he was in absolute denial. He eventually heals up and transfers out. After a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and assholish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. When I was a medical student, we had a patient on one of my rotations that was getting oral pain meds but insisting that we switch them to a stronger IV pain medicine because they had been getting nauseous and vomiting up all their meds. When our team rounded on the patients to check on them, we walked into the room and were quickly greeted by an eager patient that had been waiting to show us their vomit bag. Turns out that it was filled with a lovely mixture of piss and tea and topped off with a handful of pills the patient had thrown in there to make it look like they couldn't keep the meds down. When we called them out, the patient was in total denial and tried to reason with us that it must be vomit since it's in the vomit bag. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird. And awkward. Maybe his wife really likes Pepsi. How the remote control to a Zenith television wound up in the rectum of a 54-year-old father of 2. They stopped making Zenith television sets years ago. From a medical perspective, why do you still own this remote? Only work records in a clinic. But we had a woman come in with a report of vaginal odor. All well and good. It happens all the time in an OB-GYN clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. I want to make sure I'm understanding this clearly. She had a tampon stuck in her vagina for 7 years. Not a doctor but work in an ER. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high-ish lol. Had a woman on my OB-GYN rotation during med school that had pelvic inflammatory disease with bilateral abscesses around the fallopian tubes requiring drainage and IV antibiotics. Cause? Well, she never admitted to it, but we believe that she was repetitively using unwashed sex toys to pleasure herself for weeks based on the culture that grew and her story not adding up. I have told this story before on Reddit, but not for a while. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enter ER in sweatpants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment. And that he now wanted to get things taken care of. During the physical exam I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call in urology and order a CT scan. I tell the guy that this isn't inflammation. It is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. Not the doctor, but patient. Doctor asked me during a physical when my last test for gonorrhea and chlamydia was. And never asked whether I've been sexually active. I'm a virgin. My doctor was cute. And for some reason I felt embarrassed to admit I haven't had sex, so just rolled with the recommended urine test. $250 plus and the expected negative results later. I felt really stupid. Looking back. Pretty weird thing to not just admit. My doctor couldn't care less what my sex life was like. Would have saved me some money. Yikes. Edit. I'm male. Not sure if that provides useful context or not. This was a routine. Non-symptomatic physical. I get yearly physicals. Have never been asked to take an ST test before. And was asked this time if it'd be okay that I get tested. Fondle and cough was not performed at this physical. So opt-outs were definitely in season. So in my story, I'm actually the patient not telling the doctor something. But I felt like it was good edort and relevant enough to share. But when I was like 13 or so I ended up with a urinary tract infection. Which was odd because I'm a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great.